if you have ever used an antifungal tablet or you are currently using any of the antifungal tablets, especially ketoconazole, you need to stop scrolling and listen to what I'm about to say. Okay?
Okay, my love.
So, earlier last week, that is the month of July 2026, NAFDAC released an official statement discontinuing the registration of ketoconazole tablets. So in this video, I'm going to explain in details what that statement means, you understand, and why it was discontinued, and what you need to know about this drug that has been discontinued. Because it is our duty, Gooddy Pharma, to help you know your medication and use it right. So I'm going to be explaining why that official statement was made by NAFDAC, that is National Agency for Food and Drug Administration and Control. You understand? It is an agency, it is a body. NAFDAC is a body that regulates the production, the sales, the manufacture of food and drug. They ensure safety, efficacy, and it meets the required standards. That means the registration of those current ketoconazole tablets we have will no longer be renewed, and new ketoconazole tablets will never be registered. Now, ketoconazole tablet is an antifungal tablet. It is used to treat fungal infections. Infections like ringworm, athlete foot, junk itch, and different kind of systemic fungal infection. That is what it has been known for decades now. But of recent, it was discontinued. And that means over the time, we will no longer have ketoconazole tablet. It will be a thing of the past. And the reason for discontinuing this tablet is what I want to explain to you. So you have to pay attention to this. This tablet has been known for hepatotoxicity. What does that mean? It means ketoconazole has the ability, the capacity to destroy liver. And how does this happen? If you take your ketoconazole tablets, it gets absorbed into the systemic circulation, and the liver enzymes will metabolize this ketoconazole into a toxic metabolite that eventually damage the liver cells. And once that happens, you can go down with liver failure, you can go down with hepatitis and different kind of liver disease, which does not worth it. And that is why NAFDAC has deemed it necessary to discontinue the registration of ketoconazole tablets. Mind you, other countries have done this years ago. So I don't know why it took this body this time to actually do this, knowing fully well that the risk ratio of this drug outweighs the benefits. And not just that, ketoconazole has also been known to inhibit an enzyme, the cytochrome P450 enzyme, especially the CYP3A4, which is the code for this particular cytochrome P450 enzyme. So ketoconazole has been known to inhibit this enzyme, and ideally, under normal circumstances, this enzyme is important in the metabolism of different drugs, of so many drugs. Of course, the drugs we take does not stay in our system forever. It's being metabolized by this enzyme and eventually leaves the system. So if ketoconazole can inhibit this enzyme from metabolizing certain drugs, it means there will be an accumulation of these drugs and eventually lead to toxicity. And remember my normal saying that the difference between a poison and a drug is the dose and the duration.
Are you seriously?
You understand it? So these are the reasons why this ketoconazole tablet has been discontinued. Then the last but not the least is it has the ability to reduce the production of steroid hormones. If this steroid hormone is being reduced, there will be a reduction in hormones like testosterone, cortisol, and the necessary hormone that the body needs, which can eventually lead to erectile dysfunction for men.
Are you serious?
Now, I also need to state this. The statement stated the discontinued registration of ketoconazole tablet, not the cream, not the shampoo. That means the shampoo will still be in the market. So if you see ketoconazole shampoo in the market, it does not call for an alarm, because it was not part of what NAFDAC discontinued, including the cream. Those ones you will still find them in the market. Why? Because it is not being absorbed into the systemic circulation like the one you take orally. The cream you apply has little to no effect in your blood. The shampoo you use has little to no effect in systemic circulation. So, and most times toxicity of a drug is based on dose and the duration. You understand? But in the case of ketoconazole, it is not predictable. Any strength can lead to this liver toxicity, that is hepatotoxicity. Any dose at all can lead to that. So it is not predictable. It's not a question of, yeah, if you take it for a fewer number of days, 2 days, 3 days, you will not have this side effect. No, and that is why NAFDAC deemed it necessary to discontinue this tablet. So I know some persons are yet to get this update.
That's correct.
And that is why I'm bringing it to you in this format, so that you will be aware that with time, we no longer have ketoconazole tablets. There are other antifungal groups that even do better than ketoconazole tablets. So this is for those who are currently on ketoconazole tablets. If you are currently using ketoconazole tablets to treat any of the fungal infection I mentioned earlier, this is me telling you to meet your pharmacist, consult your doctor, and they will change the ketoconazole tablet to a better one. We have drugs like fluconazole, we have itraconazole, and the rest of the azole that can even perform better than ketoconazole without giving you any of the side effects I just mentioned. Okay, so having brought this to you, now you are aware that ketoconazole tablet has been discontinued. It was not banned. They did not ban it. They only discontinued the registration. So it's going to take a little time for this ketoconazole to gradually leave the market. But to be on the safer side, because I always encourage you to know your medication and use it right, I would advise do away with anything that has to do with ketoconazole tablets for your safety. Thank you very much, and see you in my next video.